And there we go. Welcome to the November session of the Disabilities and Conditions of Aging Network. It is a pleasure to see all of you, and thank you again for your support in attending this meeting whenever you have the opportunity to. Please do use the chat to enter any information, any links that you would like for me to send out after the meeting to the rest of the network. There are over 100 people who actually do receive my updates and the invitations to this meeting. So again, thank you all for joining. I'm Jeremy Warner. Walking Spirit is my organization. If there is anybody who is new, this network was created really with the intent of giving people who are working within the disability community and organizations that are supportive of the disability community the opportunity to connect, to talk about what we have going on in our own little parts of this world and this community, and look for ways that we can partner, ways that we can promote each other's work. Little update on what's going on with Walking Spirit. I am actually, and I'm thrilled to be doing this. I am presenting on inclusive hospitality at the Ohio Hotel and Lodging Association conference next Tuesday. And that really was the original mission behind Walking Spirit, was to connect with hotels and restaurants and other hospitality operations to make them more accessible in their approach to diversity, equity, inclusion, and growing or fostering a sense of belonging among both their associates and their consumers with disabilities. I believe that the more accessible our communities become, that the more we actually will improve emotional and mental health at a societal level. So, because everybody's able to participate together and feels as if they belong. So, other things coming up with Walking Spirit, we'll be talking more about this over the next several months, but I have been asked to coordinate a big celebration for the 35th anniversary of the ADA. That will be, we are currently looking at doing it on July 26th of 2025. That date may still change depending on venue availability, but one of the things that we are hoping to do with that is to connect with a disability march that will be taking place on that day, for us to essentially host a watch party for a disability march that will be taking place from Selma to Montgomery, across that bridge. Is it the Edmund Pettus Bridge, I think is the name of it? Essentially symbolizing the fact that people with disabilities, while we were there, were left out of the civil rights movement, the Civil Rights Act, that we had to continue to fight for those same protections from discrimination until 1990 when we got the ADA. And so that is something that is happening at a multi-state level, and very much looking forward to participating in that as best we can from here, as much as I would love to go down there and be part of that march. But at this point, we are looking at doing that celebration on the actual anniversary. More to come on that. And I will probably be reaching out over the next month or two to ask some of you if you would be interested in participating. And if anybody is interested in getting involved, whether it's as a sponsor or as a vendor, please shoot me an email, let me know. If it doesn't happen on the actual anniversary, it will happen within the month of July of 2025. So that's going to be taking a lot of my focus as we move into the new year. That's what I have to share at the moment. I am going to pass it on to Heather Wildrick Holman. Would you like to fill us in on what's going on in your part of the disability community?
Hi, good morning. I was really thinking and processing what might be helpful to share this morning. Of course, I'm Heather Wildrick Holman with Firefly. representing the whole entire agency, but more specifically, I'm an assistant director within our prevention program called Community Partners for Child Safety. We are really busy with Hope for the Holidays, busy, of course, doing performance reviews and anxiously waiting to hear back if our contract was has been renewed. We'll hear about that in January. The other thing we are just really doing is keeping our ear to the ground to hear how the communities we serve across Marion County and the other counties across the state, how they're just feeling after the election. So really tuning into spaces where we serve a great deal of immigrants and refugees. So we are, just leaning into doing a lot of listening and taking in how we can best continue to serve our community. So that, I wish I had more updates. We do have a newborn baby care that we are working on that will be happening in early March, finalizing the various translated flyers for that event happening at Mary Rigg Community Center. Would love to share that with you all. I'll get that flyer to Jeremy if anyone is interested. It's free. It really just looks at, it goes above and beyond a typical community baby shower and just really going through things like how to deal with a crying baby, all the ins and outs of, taking care of a newborn. So thanks. I think those are my updates.
Thank you, Heather. I appreciate that. I'm curious, along with that program, if you had somebody who came to you with a disability that added to or would require different techniques, assistive technology, that type of thing, to be able to provide the care that a newborn needs, is that something that would be part of that program?
So we have a newborn baby care PowerPoint that we are really basing and building it around. What we are open to, and I think would be a great opportunity, is we are seeking vendors for that event. So if anyone would be connected to or know of a community provider that could come and we would give them an opportunity to speak at the event. We would definitely have them as a vendor. We would be glad to incorporate that into the event and look at how we could, make sure those kinds of resources are available.
Thanks. I appreciate that. I know that frequently, both for parents who have disabilities, figuring those things out is a challenge, and you have to. And but also, even if you could include resources for organizations that work with newborns with disabilities, because that's another challenge that is regularly missed. I think it is a real struggle for parents who have a child with a disability, and being able to find the resources to help them support that child's needs. They don't
Absolutely.
necessarily leave the hospital with it. So
No, definitely. I'm not sure if they're on this call. So we, Indiana Family to Family, we always highlight and promote that organization, Joseph Malley Foundation. But you're absolutely right. We're always really wanting to become as well versed as we possibly can, because we don't ever want to provide cookie cutter services to the families that we serve. So always looking to build that network of resources. And that's one of the reasons why, we love being here in this space and getting to learn and glean off of all of you. So please, please, please help us, do better. And if folks know about resources that would be great to have at events like that, let us know.
thank you. All right, so I will call on, and does anybody else have any questions for Heather or anything that they want to put her on the spot with? Okay. Kristen Ludiker-Siebert, how are you?
I'm good. I was finishing typing something.
Oops. You
That's
want me to give you a
okay.
moment?
Now I forgot what I was saying. There we go. It's to you anyway.
Oh,
We're
okay.
talking about Indiana Family to Family. Marty Stone attends my Hamilton County System of Care meeting. So if you want to link up with them, I can do like any type of introduction there.
She's been
Awesome.
here
Thanks.
before as well, and I know
Oh,
that
that's right.
they are definitely on the distribution list. So yeah.
Awesome. Okay, never mind. Never mind. All right. So, really the two we're getting into November, which is where like I'm kind of wrapping up my life for the end of the year. Really the two things that I would like to mention in here. One is that starting in 2025, I am expanding my Understanding ACEs training. So I'm an ACEs master trainer. And part of what we've learned in our quarterly ACEs Master Trainer Indiana meetings is how to add on what are called PACEs, but it's positive childhood experiences. So it really builds upon that resiliency piece and looking at positive childhood experiences as well as other ways to build resiliency. So I'm going to be expanding my training to include that starting in 2025. If anybody is interested in that or know anybody that would be interested in learning about that. Sonia's like, oh, me, yay, good. And secondly, Hamilton County back in, wait, what year is this? It's 2024. So back in early 2023, um, the Indiana Department of Health reached out to me and they have been doing now for 4 years what's called a trauma-informed primary care learning collaborative. So it started off for the first 2 years, just primary care offices, so just doctors' offices, et cetera. So in 2023, they reached out actually to DMHA and said, we want to see what this looks like with a collaborative group. So if we go further than just primary care offices. So DMHA linked IDOH with me in regards to the Hamilton County System of Care. And we went through what was their implementation year 3. So year 1 for us in regards to implementing trauma-informed information within all persons serving agencies in Hamilton County. So in the first year, we kind of built up what we want to do. And we're moving into the second year now, which is like wrapping that up, getting the pretty bows on it, and then reaching out in regards to how we can better make person serving agencies in Hamilton County better trauma informed. So things such as like housing is a part of it, right? Because housing is could really impact trauma can really impact housing. So one of the things I wanted to ask anyone here is if you would be interested in being a part of our learning collaborative. So to give that perspective, Sonia's just jumping in on everything here. I love it. I love it. But yeah, in giving that perspective, because we want to get as many perspectives in there as we can, because you never know. And even when I say person serving, I mean restaurants, I mean hotels, I mean, places like that where those person serving organizations never know what type of person they will be encountering. So how can they be trauma informed when it comes to all of their interactions? So Sonia, I'll totally be reaching out to you in regards to that. And if anyone else is interested, I put my email in the chat. Please reach out to me because we would love to have as many folks involved as possible. We currently have, I'm leading it. ChildCare Answers is involved. Noble Act, which is the emergency duty officers for Noblesville. So they have social worker on staff as well. So they respond to the mental health calls instead of regular, police, or they go along with fire or EMTs. Who else is involved? HAND, which is housing. There are others. Delaware Township trustee, because Deb Driscoll, if anybody knows her, she loves to be involved in all of the things. So Deb's involved, but she also leads the Hamilton County Township Association. So all of the trustees and their offices are involved in that association. So she can take what is learned and pass that forward, but she can also give us as a trustee, that perspective. So it's all those different perspectives that we want to have involved. So yeah, Sonia, I will reach out. If anybody else is interested, please let me know.
Yeah, send me the info too, please.
I
So
will.
All
We
right.
wanted to get like the understanding of it under our belt for the first year. So there were only like 6 of us. And then now we're like, okay, we're ready to expand it more. Because in the beginning, we were the first group, like I said, that they brought in a collaboration that isn't just a primary care doctor office. So we spent 6 months figuring out where we even fit in this. And then finally it all clicked and we were like, okay, here's how we can take what's being taught, process that out into the community. So if we were in our year one, we'll be here in our year two, and then they will be reaching out to more collaborative groups such as mine, so systems of care, those types of things. So yeah, we're figuring it out as we go. So now we're ready for more people because we think we have a grip on kind of what we're doing going forward.
Very cool. And I mean, if I can be of any help from that hospitality service environment standpoint as well, please let me
Absolutely.
know. So,
Absolutely.
yeah.
So I understand, Kristen, that this is Hamilton County. Um, and obviously I serve Marion and Hamilton and all the surrounding counties, but is that a model that you are hoping to be able to transfer to other counties?
That's what I'm hoping. So, in understanding that Hamilton County is very different than many other counties, I understand maybe it won't be exactly what we put together to meet that need in our community, but hopefully the basics of this is why we did this, for example, can be taken over into another county and say, okay, then this is how we apply that.
Awesome.
Yeah,
Thank you.
you're welcome.
Anybody else got any questions or comments? Okay. Sonia, you want to fill us in on what's going on at Accessibility since you've been called out like 3 times in the last few moments?
Sure. So at Accessibility, we just had our first fundraiser in like a long time. So this is the first time for the staff that we currently have to have done anything like this. And it was on the 7th of November, and it was a huge success for our very first one. We, you know, there was a lot of things, a lot of cogs involved, and a lot of pieces, and we raised, we exceeded what we thought we would raise, so it was all very well, and we're already working on next year's, so and doing things.
Do you know how many people you actually were able to get there for the breakfast?
Yeah, 100.
Really?
A little over 100. Well, that was a full venue.
Yeah.
I think there was only one table that didn't have anybody at it. Or, I mean, you know what I mean?
Yeah.
Didn't have, but yeah, it was a full house. So we've already been talking about what we could have done better, how we can, it was, like I said, it was very exciting. The other thing that, we're working on is still the conference for next year. The wanted to point out that I am still doing the that Accessibility has groups, support groups. You're one support group. Yeah. Jeremy, yes, thank you. He has a support group with us for amputees. There is a neurodivergent, there is dysqueer, there is spinal cord injury, and then mine is financial wellness. Me and another coworker are working with getting people, because I believe that if you get the basics, then, and you are educated about what your personal finances or your personal basics are, then you can better navigate what is out ahead of you and go to those, and smash those barriers. So that's the thought process around the financial wellness, and it meets the second and fourth Tuesdays at 11:30, and it's going well. So anyway, I just want to remind everybody that accessibility does have those support groups, and they're for anybody, not just our consumers. And we're always striving to do better. And I think we're even going to start up the coffee talk or coffee cafe or whatever. We're going to start that back up, where that's just a support group for disability, for you come and talk. It's not to work out your goals or anything, but just a place to hang out and talk about what's going on in the world and how it is affecting you, type thing.
Yep.
And we are finding that we have a lot of our consumers that are just lonely. They just want someplace to go and say, hey, how are you doing? Meet other people in a safe environment and of like mind. So that's pretty much what we've got going on at the moment.
Thank you. Did you say where the links for the different support groups can be found on your website?
Right. You can go to website and it should be under events. And it is definitely at Eventbrite under accessibility. I will try pulling that up when the next person goes and putting it in the chat for everybody.
Thanks. Yeah, the amputee support group had been hybrid. We were meeting there in the conference room at Accessibility's office monthly, but over the last several months, we haven't had any turnout. So for at least November, December, and January, we are going all virtual. If anybody comes across somebody who's an amputee who is looking for a way to connect, they can find that both on Accessibility's website and also at walkingspirit.org on my events page. They can find the amputee support group there too. So anybody got any questions or comments for Sonia? If not, then I am going to call on Jamie Olson from Uniquely You.
Hi guys, good morning. Glad to be here. Thanks so much for hosting. Always wonderful to catch up with everybody and hear all the great things going on. I put a couple cool things in the chat for you guys to check out or to share as a resource. We just published our November issue and had the pleasure of working with the Arc of Indiana. And we have a great 6-page waiver update article that's super comprehensive and easy to read for anyone that wants to know the ins and outs and all the fun updates in one place and space. So we're excited to get that published. I also posted the link to our main site to view all the past issues and see cool ways to contribute and share stories. And then in our January issue, our New Year's edition, we deadline for that tomorrow. And so I did go ahead and share a jot form in the chat box for anyone to contribute or participate that serves those with disabilities or has disabilities and wants to share some fun milestones, memories, moments, places traveled in 2024. So feel free to pop that in there. It could be highlighting something fun your organization did or a way your organization gave back or something you guys did together or however you want to phrase that. So we're happy to do some shout outs and highlights in our New Year's edition for January. I'll put in the chat box here in a minute, so anyone that wants to participate has the ability to, but every month we have the pleasure of featuring a nonprofit organization that supports those with disabilities and special needs. And so we can help, write that story for free and bring awareness to what your organization is doing. And so I'll put that link in the chat if anyone wants to participate in that free opportunity to bring awareness to the great work that you're doing. So yeah, happy to be here and always open to ideas and thoughts as we're planning content for 2025 and ways to celebrate and impact and support the special needs community. So thanks guys for having me.
Thank you. Out of curiosity, do you have subscribers in every county throughout the state?
Pretty much. We reach currently digitally over 30,000 throughout the state of Indiana, and we mail over 1,200 physical printed copies to like Indianapolis, surrounding county area. A few outside, that realm if they absolutely want to get it in print. We've had several people reach out that don't get access to, they can't afford cable or internet or phone and don't know what's going on, have to schedule all their transportation in advance. So we do have our local event section in the back of the magazine where anyone can share with us events they have going on and things they want others in the community to know about so they can plug into. And so if you have specific events and things that you want us to share or let people know about, you can always share those with us, and we'll be happy to get them in our next upcoming published issue, so more people can find the resource to plug in and feel supported.
Very cool. Thank you. Well, you may need to lean heavily on me to lean on you. Because I get so busy. I know you have sent me things to submit stuff, and there's a couple things coming up next year that I think we need to partner on. So
Sure. Yeah. Happy to talk more about that.
All right. Anybody got anything for Jamie? All right. Then I'm going to call on Rick Edwards to talk a little bit about DNR and accessibility and other stuff, probably ADA Indiana. Rick, you unmuted for a moment. What's going on? Huh. Okay, Rick, I will come back to you because I know you're there. I'm going to call on Morella Dominguez then and ask you to fill us in on your part of the disability community.
Sorry, now I got it. Sorry.
Oh, sorry. Hang on, Morella. Rick's back. Go ahead, Rick.
Okay, sorry. I was muted and then went to a different Zoom.
Wow.
I don't know what's going on here. Technology. Get off my lawn. Speaking of old guys, I'm hopefully you're going to be encouraged by the next year's Outdoor Indiana. If you're not familiar with Outdoor Indiana, it's a book publication that DNR puts out. On the front cover will be we're still choosing the photograph, but it'll either be a gal that I know from up north using a track chair on one of our properties, or a gal in her wheelchair sitting on top of the tower at the Dunes State Park. And we're highlighting a lot of the accessibility features that we're working on currently. I was telling our parks director yesterday that I was frustrated hearing a lot of the other states talking about their accessibility features and programs. And I said, criminy, we've been doing that since, the 1900s, for crying out loud. And so at any rate, we are highlighting a number of things. If you've not logged on to our accessibility page, I would encourage you to do that by going to in.gov and look up DNR's accessibility page there. It's got a lot of things that I think we're really excited about, including the $50 million that Eli Lilly gave us for a number of things, including track chairs. Every park is going to have a track chair. I think I've mentioned that before. We're doing a lot in terms of playgrounds and accessibility at a number of our properties. So you're going to see, if you haven't already, you're going to see an awful lot of new accessible vault toilets, new accessible trails, new accessible comfort stations, new accessible playgrounds, and that sort of thing. Shifting gears a little bit, if I can, Jeremy, with the recent election, I think that it's going to be vitally important for states to talk to their legislators and try and adopt a lot of the ADA in their Indiana codes or in their state codes. We already have kind of done that, but a lot of people don't know about it. There is a provision in the Indiana Building Code that says we, as a state, cannot adopt any rule regulation that is not consistent with the ADA. And given that it looks like there are going to be a lot of things thrown back to the states, that we need to make sure that our legislators, our building code officials understand that they really are already obligated to adhere to many things in the ADA. I know at DNR, we're working on making sure that our policies are consistent with the definitions that are in the ADA. And so we're working on that as an agency, but we need to also work on that as a state, because like I said, if things are going to happen the way it looks like they're going to happen, the federal government's going to be significantly cut. And the Department of Justice, the Access Board, places like that are going to have to rely on states to carry the water. So that's what I've got.
Thank you. Anybody got any questions for Rick on either of those? Or suggestions? Any comments? Rick?
I didn't say anything. Sorry, Jeremy, I didn't say anything about the ADA steering committee. We are still planning on having a conference next year of some sort. I'm going to be talking to a number of entities, including those who are on here, to see about collaborating. But the state steering committee has a number of experts on their committee that I think would already do well. People like Kim Parlberg and Jeremy, certainly. Nick Stelma, who's with the Department of Corrections, as their ADA coordinator. We've got a number of folks that we can draw on, including people like Jennifer Skulski and Bill Botten with the Access, or was with the Access Board, folks like that. So I'm looking to pull that together as a steering committee next year and get some collaboration going with some folks here.
Well,
Thanks.
And Rick, so I think the opportunity is absolutely there to tie that conference to what we're doing with the ADA celebration. If it's a one-day thing, I know that in what I was looking at, I know that the Indy Marriott Place properties, that they have meeting space open for that day. And if it's a multi-day thing, I know that they actually have a lot, currently at least, they have a lot of their accessible rooms across the 3 different hotels on that corner are available. So that's a prime opportunity for us to look at. So we should talk more about that.
Thanks.
I was going to ask, would you like to maybe go more in depth in regards to what you were talking about, Indiana Building Code, and making certain that the ADA is supported at a state level? Would you like to talk about that more in depth, perhaps at a future network where we could advertise in advance that we're going to spotlight that conversation?
Sure, sounds like a winner. Yep.
Okay. All right. All right, then that said, unless you have anything else to add, I'm gonna ask Morella Dominguez to jump in.
Hi, everyone. In our area at Shalom Healthcare Center, we continue, of course, helping the diverse community and also people with disability. We are really toward to help them with resources through our social worker. She always bring good new resources for anybody that needs it, especially with this community that we know have a very special care. And also we are part of the trauma collaborative efforts. That is something that is going very well in the agency. And yeah, I encourage, everybody to think about that, because it's something that is going well as a primary care. And I didn't know that it's expanded to other organizations, which I think that's awesome. So that's pretty much what we are doing at Shalom. It's continued effort. I'm very happy to be part of this group. We would like to do more. So anything that we can do to keep going and, to be working together for this purpose, please let us know. Yes, as somebody mentioned, I don't know, but yes, we are, people are concerned about what's going to happen with the new elections when it comes to the immigrant community and some other refugees. They are like, what's going to happen? They're scared even to go sometimes to the clinic. So we are encourage them to not to be scared, but I know there is a lot of hesitancy right now with the unknown, what's going to happen. So there will be a lot of education around that to help this community as well. Thank you, everyone.
Thank you.
Jennifer.
And
thank you.
Yeah.
And I missed it. I'm sorry, Marilla. Who are you with?
With Shalom Healthcare Center. We are a primary care clinic. We have 3 clinics, 2 on the west side, 1 at the 92 and Meridian. We serve mainly the underserved people that do not have access to healthcare. So we have a discount program to help them to access healthcare in an affordable way. But we see, a lot of people with different backgrounds and situations, especially with the people that are more in need. Let's put it that way. Yeah.
Okay. Thank you.
Thank you.
Thank you very much. And yeah, access to healthcare is one of the top issues that people with disabilities face. So thank you very much for being here and for being part of this community. All right, let's see. Speaking of, so Chalicia Howard, would you like to jump in?
Of course I would. Good morning. Let's see. Well, Caresource is a health insurance company. We are a nonprofit. However, there are tons of other things that we do. So my coworker Adam jumped off early, but I was hoping that he would be able to talk more about the life services program that we offer to our members. So we have all of our benefits and enhanced benefits are available to all of our members across the state. However, there are parts where we get to delve deeper into the lives of our members if they need, more guidance or more assistance with certain things. So that being said, we do have a life services program available for our members where it ties them to a life coach. So we have life coaches who are able to meet with our members in person or virtually, or just talk on the phone to help to assist with any types of barriers and challenges that they're experiencing, regardless, what facet or to what degree it is. So on our regular member service line, someone may call and just say, hey, I need help. Where's a pantry? Or I need a ride to this place, or that type of thing. But in the life services program, we go a lot deeper with our members and with their immediate family members and others in the household. So we do assist with, transportation to food pantries, diaper banks, and other things like that, along with the doctor's appointments and prescription pickup and all of that type of stuff. But we also, to go even further, we do help with, we have a reentry program. We do a lot with moms and babies. We do a lot with everybody with education. And we do this, and this is for ages 0 to 64. So we do that. We also help with employment and with housing for our members. So we do have members that have certain challenges that they face, whether it be themselves personally or with, their children who are sometimes born with disabilities and things. And so we definitely do all that we can to assist to make sure that every appointment is gotten to, any type of follow-up that's needed. We have people on our life services team and our care managers who will come out to the house and bring things. And we do partner, of course, with you, Jeremy, and with others on this call, but we are always open to deepening those partnerships, and we do sponsorships and all of that stuff as well. So in this new year, we're just looking to continue to make an impact on our surrounding community across the state of Indiana, to help wherever we can, to help to continue to build up our communities and eliminate barriers. So yeah, that's that. So if anybody needs to connect with me, my information is in the chat. But yeah, I'm just looking forward to everything. And I already now have marked July 26th on my calendar. So I'll be looking, I'm already excited about that.
Thank you very much. It would be great if you and Adam could host a booth at that. I think that would be a wonderful opportunity. And so yeah, I'll be more in touch about those things as we get closer. And please let Adam know I'm sorry that I didn't get to him before he had to jump off. I am bad at watching the chat while we are having our session to see, and I don't know if he put anything in there about needing to go or not, but I will say
Yes.
just for future opportunities, yeah, for future sessions, if somebody's got to go and they want to get in before they have to leave, please put that in there and even speak up and interrupt me. I know there've been a couple sessions where folks have been here and have had to go before they've had an opportunity to speak. And that I'm always disappointed when I didn't get to somebody in time. So let's see, we are at 10:47, Tim. I am not going to forget you, Tim. You are next.
I don't have a lot to say. I'm learning to live with a new wrist as a polio survivor, and it's driving me up the wall.
Really?
Yes. In our disability committee at the churches, there's been a wholesale reorganization, and we're still learning what all the effects of that are. So there hasn't been much going on beyond that.
Okay. Do you want to share a little bit more about what trying to adapt to your new wrist is, why that's driving you up the wall? I feel like you have insight that that we don't necessarily have.
Well, I was told that the surgery, I would be in the hospital overnight and then in rehab for 2 weeks. I was in the hospital for 2 weeks.
Yeah.
And in rehab for 2 months, and came home sort of functioning halfway. And people say, well, it's not a big deal. It's just your wrist, but it's changed the things like the glove size I wear.
Oh, wow.
I have to get a new wheelchair because I can't get into the old one with the different foot bar.
Okay.
Because I can't handle that anymore. They also went into my hip for bone chips. That became infected. That had a lot to do with why I stayed in the hospital for so long. When you have a disability, a lot of what a doctor or medical person may tell you is usually a best guess.
Have you, if you don't mind my asking, have you had to deal with post-polio syndrome?
Yes.
And that is something I have learned a tiny bit about this year, but my understanding is that that is one of those situations where the typical medical approach for the issues, if they don't understand that it's actually post-polio syndrome, that for instance, the physical therapy can actually make the symptoms worse. Am I correct in understanding that?
Yes, the early rounds of PT, especially dealing with my wrist, drove me out of sync with the rest of my body. And it seems odd that a surgery on the wrist would leave me unable to move my legs the way I need to sit in a wheelchair, but it did.
Okay. Yeah, and that's why I appreciate you being willing to share, because even being different people with diverse disabilities, if we have them ourselves, we're only experts on our own disability. And the more that we can learn about what other folks are experiencing, the more that we can help educate and hopefully elevate our society. So thank you for sharing what you're dealing with. That's kind of why I held you off towards the end today.
Well, I'm glad I could contribute.
It's important, Tim, and I truly appreciate your, as I said to everybody at the beginning, your support and being here. Everybody has something to bring, even when they come on and say, I don't know that I have anything today. Everybody always does, and the contributions are huge. So thank you all. Any last remaining comments? I know some folks need to go, and if I can give you a moment for a bio break before an 11 a.m. session, I am happy to do that. But thank you all very much. Any last minute comments? Feel free to jump in. Otherwise, enjoy the rest of your day. Have a happy Thanksgiving. Remember, we are meeting early in December as well. So on a Tuesday instead of a Thursday. So see you hopefully in December.
Have a great week.
You too. Be well.